dealing with discomfort and wondering if it's hemorrhoids, you are not alone. I'm here to help with absolutely everything. Before you try another home remedy, let's talk about what actually works and when you need to see a specialist. Hello, my name is Rajeev Peravali. I'm a consultant general and colorectal surgeon. I deal with bowel-related issues. One of the most common issues is hemorrhoids. I'm based at Midlands Colorectal, which is in and around Birmingham and the West Midlands. If you have hemorrhoids, listen to this. Let's start with the basics. What are the different types of hemorrhoids? Hemorrhoids generally are classified between grades 1 and grade 4. Grade 1 are very relatively minor hemorrhoids. These are small hemorrhoids that cause some bleeding or discomfort when you go to the toilet. You don't normally notice any lumps when you pass stool. Grade 2, you might notice some swelling around the bottom when you open your bowels. Grade 3 hemorrhoids are when lumps protrude from the anus when you go to the toilet, and often you have to push them back in. Grade 4 are very large hemorrhoids that are permanently on the outside. These are the most severe hemorrhoids and often require significant treatment or management strategies. Bleeding from hemorrhoids. This is what it means. What are the common symptoms of hemorrhoids? So different people present in different ways when it comes to hemorrhoids. Some people present with just swelling around the anus. Other people present with bleeding, and some people present with pain or discomfort. A lot of people present with a combination of all three. The bigger the hemorrhoid, the more severe the grade of hemorrhoid, the more severe the symptoms. Another symptom that people often present with is a feeling of fullness or incomplete emptying when going to the lavatory, and this is often very distressing. Are you at risk for hemorrhoids? Here's what you need to know. What causes hemorrhoids? Hemorrhoids are caused by a number of things. The most common cause is constipation and straining. Constipation and straining over prolonged periods of time does increase the risk of hemorrhoids. Other factors could also increase your chances of hemorrhoids. These include pregnancy, obesity, lack of physical activity, and also conditions like irritable bowel syndrome, where people have prolonged periods of loose stools, over bowel activity or under bowel activity based on their condition. How are hemorrhoids diagnosed by a specialist? So if you're getting problems from hemorrhoids, you come and see a specialist, someone like me. And when you enter the consultation room, the first thing I would do is take a full and thorough history. And these are, what are your symptoms? And I'll talk to you about your pain, your lumps, any bleeding, whether you need to sit on the toilet for prolonged periods of time, whether you strain, whether these lumps come out, whether you need to push them back in. Following the history, I then go on to examine you. The examination is a full and thorough examination. It involves examining your abdomen as well as your back passage. Examination of your back passage means looking at the anus and the surrounding area. I will examine also with a finger. It's called a digital rectal examination. And then I will also use a little telescope called a rigid sigmoidoscopy or a proctoscopy to look specifically at and around the bottom and the anal canal. This tells me what's going on and what the diagnosis is. And following this, we'll then talk about treatment strategies. The treatment strategies will depend upon what is found during the history and the examination. Sometimes, although you have relatively minor symptoms, or you feel you have very minor symptoms, when you see me or another specialist, we will really dig into your symptoms. And if we find that there are some things that don't quite fit, or some things that are of more concern, we may recommend further investigations before attributing your symptoms to hemorrhoids alone. And that might be a colonoscopy, that might be a flexible sigmoidoscopy, or that might include certain scans, all of which is really important to confirm the diagnosis of hemorrhoids and make sure we're not missing something more serious. Treatments for hemorrhoids will depend upon the severity or grade of the hemorrhoids. Now, grade 1 hemorrhoids are generally treated by conservative measures. What are conservative measures? Conservative measures are improving your diet. That means eating healthy, improving your fiber intake, improving your fluid intake. You need to aim for at least 30 to 50 grams of fiber daily. You need to be drinking lots of fluid. That means 2 to 3 liters of fluid for an average adult daily. Things like coffees and teas do not count. They dehydrate you and actually take from this 2.5 liters. You need to be leading a very healthy lifestyle, exercising 15 to 30 minutes every single day, and it improved physical activity, improves your bowel activity, and makes bowel habits much better. When going to the toilet, you need to position yourself appropriately, and that means sitting on the toilet, leaning forward, bringing your knees up towards your chest. What this does is it improves the angle at which you defecate and improves the rate at which the poo exits you. And that makes the whole process a lot more comfortable. Within the lavatory, you need to spend a minimal amount of time on the toilet. That is 5 to 10 minutes maximum. Do not spend prolonged periods of time there, because that increases your chances not only of developing hemorrhoids, but it also reduces the chances of any treatments that we give you working. Grade 2s and 3 hemorrhoids usually are a bit more symptomatic, and we talked about this earlier, where you have swelling around your bottom. Now, these swellings can be treated by a number of ways. Grade 2s and 3s generally do not require surgery, and we can do more minimally invasive procedures. Minimally invasive procedures include rubber band ligations. What is rubber band ligation? Rubber band ligation is where in the clinic setting, I would provide you with this treatment. You'd be on your side, I place a little plastic tube in your bottom, and with the use of a small machine, I place a little elastic band over the top of your hemorrhoid. What happens then is that in about a week, 10 days time, the hemorrhoid falls off. Now, this is a very effective treatment, and it's very simple. Some people find they have a little bit of discomfort during, immediately after the procedure, but it's generally very well tolerated. Other relatively minimally invasive treatments for hemorrhoids include X-Roid. X-Roid is an electrotherapy treatment. Again, it's done in the outpatient setting with you on your side. This can take a little bit longer, up to 30 minutes when we treat up to 3 of your hemorrhoids, and it is also effective. Thirdly, there are other procedures. The Raffaello procedure uses radio frequency ablation to reduce the blood supply to the hemorrhoids, causing them to shrink. When it gets to the larger hemorrhoids, the grade 4 hemorrhoids, are really the only effective treatment for these large hemorrhoids is surgery. The best surgery by far is hemorrhoidectomy. This literally means cutting away the hemorrhoid. Hemorrhoidectomy has a really bad reputation because people think it does cause a lot of pain. On the converse to this, it is the only proven treatment that is 100% effective. If done by the right people in the right way, it is uncomfortable, but it is also very, very effective. Generally speaking, I tell my patients that there is 2 weeks of quite significant pain, followed by 2 weeks of discomfort, and then they're very, very, very happy with the results. Why is hemorrhoidectomy painful? You can imagine that if you have a cut on your arm or your leg, you would leave it and rest it and not touch it, and it would heal. Having a cut on your bottom is significantly more severe because you're still going to the toilet, you're still washing, you're still wiping, you're still cleaning, and all of these things significantly increase the discomfort to the area.